He had titanium rods and screws implanted in his neck, and because of the surgery, he can't move his head at all. You can see how restricted his movement is while he's running, and even when he's getting a kick to the head. In 2011, Yoel Romero got such a severe neck injury that he required fusion of the base of the skull to the rest of the cervical spine. The way we do this surgery is by placing the patient in a prone position on their belly, and then we place their head in something called a Mayfield skull plate. This device will attach the person's head to the bed so that way they're stationary whenever we're doing surgery. We make a sizable incision at the base of the skull down the midline of the neck, and after we expose the skull as well as the posterior aspects of the cervical vertebrae, we then place our titanium hardware. We will place titanium screws into the lateral most component of the cervical vertebrae in the back, and then we would attach an occipital plate to the base of the skull where we would have screws that penetrate the skull and go all the way through to the inner cortical surface of the skull. Now, it's really important that these screws don't enter the back portion of the brain because there are some very important blood vessels in that area that if they become injured could potentially be fatal. Once the screws and the plate are in place, we'll then secure it all together with metal rods. This would effectively eliminate all range of motion in the neck, which is why when he's out running, you can see that he barely has any movement in his head. And even when he gets kicked to the head, there's barely any motion. Now, some people say he has an unfair advantage when he's fighting because he can take a hit to the head like nobody else can, because basically his neck is reinforced with titanium hardware, but at the same time he's placing himself at an extremely high risk for developing complete paralysis if that hardware fractures.